Smoking in Minnesota is on the decline. A new study from the nonprofit Clearway Minnesota says only 14% of Minnesotans are smoking now compared to 22% in 1999. And as our Scott Sheehan tells us, the decline is due in large part to the laws making smoking harder.
About 5,000 Minnesotans die every year from tobacco use and cost about $3 billion in excess health care, or about $540 per Minnesotan. Despite the recent drop in smoking in Minnesota, Clearway Minnesota researchers say smoking is still a problem.
We're making good progress there, but we still feel that tobacco is a public health priority. Unfortunately, it still does cause a lot of death and disease, a lot of health insurance costs related to tobacco. So we want to still do as much as we can to really drive that rate down and reduce the harm of tobacco.
In 2013, Minnesota politicians put a $1.60 sales tax on a pack of cigarettes as a way to deter Minnesotans from smoking. Minnesota was also one of the first states in 1975 to put limitations on smoking indoors, and Sheldon says those policies have helped limit the amount of smokers in Minnesota.
Strong youth access laws, making sure they can't purchase cigarettes or tobacco. All of those things really do kind of work together to prevent youth from ever starting, and it also is effective at helping current smokers quit.
If a smoker would like to quit but doesn't think they could afford it, there are programs like Quick Plan Services that can help give support and the ability to access things like the patch to help them quit. And in 2014, a Blue Cross and Blue Shield of Minnesota survey found Minnesotans approve of the restrictions on smoking indoors, with 87% of Minnesotans approving the Freedom to Breathe Act. In Brainerd, Scott Sheehan, Lakeland News.
If you'd like more information about how to quit smoking, visit our links page on our website, lptv.org.
If you've enjoyed this segment of Lakeland News, please consider making a tax-deductible contribution to Lakeland Public Television.